Doctors of Reddit, how often do you see patients after they have tried to self-medicate? What's the worst mistake you've seen? I was working in a clinic when a man came in with his blind wife. She is diabetic, and during my questioning I found out she had had a few episodes of low blood sugar in the past few months. And I mean low as in unable to ingest food to raise her blood sugar. The husband told me he had to inject his wife to bring her around. Usually, in these cases you would inject glucagon, which is basically the opposite of insulin. It raises blood sugar. He proceeds to tell me that the glucagon is too expensive, so he has been dissolving sugar in water, drawing it up, and injecting it into her thigh. I tried to hide my shock, but it must have been obvious. He just looked at me and said, "Well, it worked, didn't it?" I tried telling him all of the reasons he should use glucagon and not sugar water, but he wouldn't have it. I even told him that the pain of the injection is probably what woke his wife up, not any increase in blood sugar. He said the glucagon was too expensive. I called around to a bunch of pharmacies and found it for $20 for 2 injections, but he still refused to buy it. We ended up calling Adult Protective Services. Good job. I am very glad you called Adult Protective Services. Lady in her mid-60s comes in with a terrible burn on her hairline and scalp. I ask what happened, and she said she was coloring her hair with the leftover dye from a month or so ago. Needless to say, she had a 3rd-degree chemical burn all over her scalp. Okay, that's problem 1. We ask her if she has any allergies because we want to give prophylactic antibiotics. She says no. We ask about her daily meds. She rattles off a bunch including 1000 milligrams of amoxicillin, Augmentin. We ask how long she's been taking the Augmentin. She replies 2 years. Every day, for 2 years, she's been taking massive doses of antibiotics. Her reasoning: to keep myself from getting sick. We went hunting for side effects, found oral and vaginal thrush, massive yeast infection in her colon, malnutrition, stomach ulcers, and multiple open sores on her feet and knees. Plus, she got a super infection on the burn site a few days later. No fun. When I was about 16, I started having these little red irritated spots show up on my arm. My mom was immediately like, "You have psoriasis is all, just go tanning." So I tanned for about a week, and they just got worse. Now I had them all over my body. I had spots on my eyelids even. So I go to the doctor finally. Turns out I had ringworm, and by tanning, I was basically rubbing them all over with the lotions and incubating while I tanned. Thanks, Mom. I posted in a thread above this about how I got ringworm from a tanning bed. IT was you. Pathologist. I've seen a few cases of patients who basically wrecked their livers through use of some sort of herbal remedy, like for weight loss or something similar. Be careful with unregulated dietary supplements is what I'm saying. We got given a case in a lecture of a man who had a rash on his foot. Googled it and decided it was eczema or some similar inflammatory disease, so ordered and applied a steroid cream. For those who don't know, these kind of steroids act by dampening the immune system, the overactivity of which is the cause of diseases like eczema and psoriasis. However, he in fact had a fungal infection and was just reducing his body's ability to fight it off. If I remember correctly, by the time he got to the doctors he needed it amputated. I have a weird rash that I can't diagnose on Google. This just convinced me to schedule a doctor's appointment. Pharmacist here. Patient came in and wanted to self-medicate his cat's Pinky. He wanted to know what the vet would prescribe and if it was available somehow over the counter. After a long and trying discussion, he is insistent on putting generic Neosporin in his cat's eye. I repeatedly instructed him that it wasn't safe due to sterility reasons and that it could harm the cat, worsen the cat's condition, or cause some other problem for the animal. His reply to me: "Well, I'll try it in my own eye first and see." And just like that, as mysteriously as he arrived, he was gone. A doctor. First one that comes to mind, although probably not the worst, was a woman who came in with worsening back pain. She had fallen the previous day and filled a gallon-size bag with ice and placed it on her back. She fell asleep with it on her back, and a few hours later she noticed that her back hurt even worse. So she took another bag of ice and put it on, and once again, fell asleep. When I examined her, she had 2 large areas of burns with blisters on her upper back, each about 6 inches in diameter. When I took a picture and showed it to her, no, I will not post the picture, Her eyes welled up with tears. She couldn't believe that ice had given her a second-degree burn. Lesson 15-20 minutes at a time every 2-3 hours maximum for heat or ice packs. In an EMT, my crew responded to a fall victim in her house last winter. She had been found on her kitchen floor by a neighbor checking in on her. I was patient contact, and as I bent down to assess the injury, I noticed the woman had tightly tied a plastic bag with some washcloths around her foot. I started cutting the bag open and saw that it was completely full of blood. Long story short, the woman had fallen on her front steps 11 hours earlier and had crawled inside and tied herself a tourniquet around her injury, which was a gruesome compound ankle dislocation, with a portion of the bone sticking out from her flesh, which was starting to turn a foul color with the amount of time that had passed since the injury. She wasn't that old, but was apparently a little senile and didn't want to call 911 or her daughter and cause anybody trouble. On the ride to the hospital, her vitals were down and she had no pulse in the affected foot. Even the trauma nurses were a little shocked by how bad it looked. I think she was pretty mobile despite the fall. Her house phone was in the same room as her, and she had a cell phone in her purse. She just thought it would be better to tie her own tourniquet and totally cut off her own circulation than to call for help. That just makes me sad. Poor dear. I work in a dental office. Most common thing we see is people placing an aspirin on their gums next to an aching tooth. All that does is severely burn the gums and makes the pain worse. I've also met a few people over the years who have taken their own teeth out with a pair of pliers. One guy we saw had a problem tooth, went to pull it out, pulled the wrong one, then tried again and pulled the problem one. He shattered the alveolar bone in that area and had to be sent to an oral surgeon immediately. Resident physician here. I've had numerous patients who've rejected medical treatment for a small, localized, and easily treatable cancer in favor of naturopathic homeopathic remedies. Inevitably, they re-present years later with diffusely metastatic cancer in their brains, liver, bones. It's everywhere. By that point, the conversation shifts from how I can cure them to how I can make them comfortable before they die. For example, woman has progesterone receptor positive breast cancer. This means that the hormone progesterone will make her cancer grow faster. She goes to her naturopath, who prescribes her tubs of progesterone cream for years, which most certainly made her cancer worse. But it's okay, she tells me. It was years of natural progesterone. Nurse here, at a get-together with friends, where the wine drinking got out of hand. I had a friend burn himself on the oven while making pizza, then try to cauterize that wound with his lighter. I'm an EMT. One of my first calls was an 80-plus-year-old man living in an assisted living facility. He had bought at least 150 bottles of some naturally lose-weight quick pills that he saw late night on TV. He had been taking an excess amount of them for at least a day straight. We got there and his mental status was clearly altered. Didn't know where he was, etc. I wish I still had the picture of the stacks of cartons he had in his small room. I still wonder how he got them inside of the facility. Med student here. Literally all the time. I've seen super overdosing OTC meds guy with bloody stool and abdominal pain who we found out used 4 goody powder packets a day for over 5 years. Patient who had someone try to nail file his hemorrhoids. Not sure how he thought that would help. Massive infections from people literally stapling a wound shut with an office stapler. I had a patient who came in saying that she had a sore throat, so she took her cat's expired antibiotics and wanted to know why she wasn't getting better. Well done, they'd expired. Geez, talk about stupid. Physician here, the one that stands out from among the rest of the field. Life-threatening problems with OTC acetaminophen, ibuprofen, naproxen happen all the day long. Happened many years ago while I was a medical student. I was serving my rural medicine rotation at a primary care practice in the sticks. A man came in for an urgent appointment for a rash. I went to see him first to get working on the history. In the exam room I met a very nice, young, fit man sitting bolt upright on the exam table looking very uncomfortable. During the history, it was revealed that he was a telephone line repairman and was working, in late summer, out on the telephone lines around the county, climbing them to reach the wires. He had been exposed to poison ivy this way over both arms and much of his torso, which had happened before. However, this time the rash was worsening with time. I asked him to remove his dark colored shirt, and after he did I almost fainted. He had open wounds all over his arms and chest. All of the blisters from the poison ivy had unroofed and the tissue underneath was destroyed. Everything was bright red, bleeding, and weeping. It looked intensely painful. I'm having a hard time describing it. It was the worst skin findings I'd ever seen. I thought for sure this was Stevens-Johnson syndrome or 10, so I started asking about medication use. He told me he takes no medications at home, but that his grandmother gave him a gallon of solution to put on the rash, which he had been using regularly since the poison ivy began. He didn't know what was in it. We called grandma. What was in it was bleach. He got to go for a fun trip to the burn center. Poor guy. Heard the story, but didn't see the patient. A woman in her 60s presented to the ER with episodes of passing out during sex. She underwent a full workup, cardiac, neurological, when she was admitted, and no cause was found, so she was discharged. She returned again with the same complaint a few days later, and divulged that this had actually happened during sex both times. Upon further questioning, it turns out that her husband had been using topical nitroglycerine paste on his penis for erectile dysfunction. When they had sex, the medicine was absorbed into her bloodstream, causing her blood pressure to drop precipitously. Her husband was advised to discontinue this practice. People with tooth pains trying some miracle remedy, and when the pain stops they think they are healed. What they don't know is that it means their nerves have been infected. In fact, so serious that the nerves died and rotting below the gums. Only until the pain starts again and their so-called remedy doesn't work do they go to the dentist. By then there is no choice but to remove the teeth and probably some additional surgery too. BTW dentists poke sharp objects at your gums for a reason. It's to check for periodontal disease. Most dentists also don't fool with making payment arrangements. This means people with no money get no dental care. Given the risk that I've heard comes with untreated abscess, I find it really concerning that dental insurance is not mandated by the ACA. I did an MRI on a patient who had treated her breast cancer with sodium bicarbonate. The patient presented to them with numbed hands and neck pain. The MRI showed extensive bony metastases and a pathological fracture of C2. Basically, the cancer had spread all through her body and had weakened her bones to the point that they were disintegrating, putting her at risk of damaging her spinal cord, or worse. It's more just sad that people want to believe that these simple remedies can treat complex issues as opposed to modern medicine. I'm a medical student. I have two that stand out. First, we had a guy come into the free clinic complaining of knee pain. He is a larger guy, an ex-football player who developed a bit of a gut after he stopped playing. He said that he has some old injuries, torn meniscus, chronic arthritis, etc. He used to go to his doctor in another state, who would drain the knee and give him a steroid injection every so often. When he lost his job, he lost his insurance too, hence being seen at the free clinic. Before he decided to come to us, though, he decided it was a good idea to take a needle and try to drain his knee himself. 4 times. On physical exam, the knee is massively swollen, tender, bright red, classic signs of a septic joint. We weren't equipped to treat it in the free clinic, so we strongly encouraged him to go to the ER. He didn't want to go because of his insurance situation. We tried to explain the gravity of the situation to him, but he refused to listen. Without prompt treatment, he could end up losing his leg. We offered to call him an ambulance to take him to the ER, but he refused and left the clinic. Never did find out what happened to him. Second, this one I heard second-hand from a classmate. We had a firefighter come in with some burns on his leg. I believe they were incurred from a drunken cooking accident rather than any on-the-job heroics, but I could be mistaken. Anyway, the burns were serious, but he was expected to make a full recovery quickly enough. He was discharged and instructed to eat a lot of protein to help him recover. He interpreted this as get as much protein into your body as possible, by any means necessary. He goes home, takes some protein powder and mixes it up with water, and sets it up in an IV. Needless to say, he developed a pretty serious bloodstream infection. It prevented his burn from healing correctly and he ended up needing a partial amputation of his foot. He eventually recovered, but it took way longer and there were so many unnecessary complications. Not me, but my friend found out a couple of months ago that she's cousins with her best friend #feature me.